When it comes to showing our gratitude, each of us has a way that reflects who we are. Some perform, some make, and some clap. Our way is MassMutual Health Bridge, a free life insurance program specifically for frontline healthcare workers battling COVID-19. And it's our way of showing thanks.
Hi, welcome to the Boston Globe's Salute to Nurses event here on Zoom. It's presented by MassMutual, and I'm really excited today. I'm a reporter at the Boston Globe. I'm really excited to be talking to these three fabulous nurses, and we're going to be taking your questions as well. We're going to be talking to them about their work up until this point, and I think what everyone's wondering is how their experience has been since they were treating coronavirus patients. So first I'm going to welcome a message from our sponsor, MassMutual. Jennifer Halloran is here with them, and she's going to just give some opening remarks, and then we will get into the event.
Great, thank you, Naomi. Good afternoon, everyone, and thank you for joining us. On behalf of MassMutual, I want to welcome everyone to today's discussion. At MassMutual, our guiding purpose has always been to help people secure their future and protect the ones that they love. We all aspire to live mutual each day, which is a belief in the power of relying on others and taking care of each other. That's why we are especially grateful right now for all of the world-class healthcare workers we have here in Massachusetts that are battling the COVID-19 pandemic. I'd especially like to thank the three nurses, the three women we have on the call today, for taking time out of their day to help participate in this panel discussion with us. Each day, thousands of healthcare workers, similar to these women, go to work and jeopardize their own health to deliver compassionate and high-quality care to everyone fighting this virus. Knowing how much they sacrifice has inspired individuals and companies to want to help. And that's why at MassMutual, a few weeks ago, we created a new free life insurance program called Health Bridge, made specifically for healthcare professionals, so we could offer our support and our gratitude. With Health Bridge, we've committed to providing up to $3 billion in free term life insurance coverage for eligible healthcare workers on fighting COVID-19 in Massachusetts and Connecticut. And we hope that you will help us spread the word around this. The process to apply and all of the underwriting and applications are completely online. It's very easy to find it on massmutuals.com website. The media and the press are also critical to all of us right now, and we are grateful to Naomi and the entire Boston Globe team for not only keeping us informed each day, but also for bringing us positive stories of hope as well. So with that, I'd like to turn it back to Naomi and our panelists so we can hear exactly how they're battling this pandemic right from the front lines. Naomi?
Thank you so much, Jennifer. So I'll just say a couple words and then I'll have our panelists introduce themselves. So nurses truly are some of the biggest unsung heroes in our medical system. On the news, we tend to hear so much from doctors, but we really rarely hear from nurses who have so much to do with the hardest and most important work for people who are really suffering. And they do it with so much heart and soul. This awful crisis around the world, though, has prompted society to fully recognize and appreciate the incredible job that all healthcare workers do, including those we don't always hear from, like nurses, respiratory therapists, assistants, and especially now when they're putting themselves at a heightened risk to take care of people. They say nursing is a calling, and I think it's clear from talking to these three nurses that you're going to hear from now that that's true, because their care for their patients, their passion for their job just shines through. With me here today are Kelly O'Neill from Tufts Medical Center, Andrea Nicholson from Boston Medical Center, and Tama Baker from Brigham and Women's Hospital. So before we get to the questions, let's meet our speakers and have them tell us a little bit about themselves. Kelly, why don't you start and tell us where you're from, why you got into nursing, and what you love most about the job.
Okay, my name is Kelly O'Neill. I'm from Wayland, Massachusetts. I went to Fairfield University, graduating in 1985, and started my career at Tufts Medical Center. So I have been here my entire career, working in various areas throughout the hospital. Currently, I am the clinical leader in the COVID ICU. We were originally a medical ICU, and then we were asked to start the first COVID ICU at Tufts, probably 6 weeks ago or so now.
And what do you love about nursing?
Oh, I just really have a passion for helping people. I love inspiring the new younger nurses coming into the field, just sharing our knowledge and just trying to share my passion for nursing with them.
Okay, Andrea, would you take a minute to just tell us, please, a little bit about yourself? Where did you grow up, and what do you love about nursing, and what prompted you to get into it?
I grew up in the island of Jamaica, and I've always, as a child, wanted to be a nurse. So when I migrated to the United States, I did some other jobs, but then eventually I went back to school and become a nurse. I worked at Boston Medical Center over the past 35 years. So I did a lot of many different jobs. And I did became a nurse here through BMC. I went to Roxbury Community College for my associate degree. And then I went to Curry College for my BSN. And then I did my master's program at Curry as well. So what I like about nursing, I love taking care of people, and I love to get the feedback of what I've done in taking care of those patients.
That's lovely. And Tama, please tell us a little bit about you. Where are you from, and what got you into nursing, and what do you like about it?
So my name is Tama Baker. I just want to start by thanking the Globe for hosting this event, and to Matt Medina for nominating me. It's honestly an honor to be here with all of you, Kelly and Andrea. And I just am proud to be able to stand up here and represent my fellow colleagues. I am from Quincy, Massachusetts, and my journey started 15 years ago. When I graduated nursing school, I was offered an interview at Brigham and Women's Hospital, and I remember my mom saying, "Take the interview, that's a really good hospital." And I did. I took the interview and I took the job. And 15 years later, I'm grateful every day that I did. I worked on that medical surgical unit for just a little under 2 years. I moved to the medical intensive care unit for almost 7, and then moved to the emergency room where I'm a staff nurse today. I was able to go per diem for a few years in between that time, and my wife and I actually travel nursed the country, which was an incredible experience. But I was always grateful to come back to Boston to my career at Brigham. My mom is a retired nurse of 47 years. My wife works at Dana-Farber as a nurse. My sister and I work together in the emergency room at Brigham and Women's. She's a nurse. My sister-in-law, my mother-in-law, my aunt, and my grandmother, all nurses. So it's quite literally in my blood. But my earliest memories of nursing were really shaped by my mom. We could be in public anywhere, and a random person would stop us, my siblings and I, and hug my mom, and my mom would hug them, and go on to tell us what a difference she made in their lives as their nurse. And I knew I always wanted to do this job. What I love about nursing, I don't think we could probably wrap up in 1 hour, but I love the friendships that I've made. The bonds with the fellow nurses and colleagues is just something I cherish every day. I love the constant learning that nursing provides to us, but mostly I would say I'm grateful for my patients and families that I've met over the past 15 years. My mom always says to me before I go to work, "Tama, remember, make a difference today." And over the past 15 years, I've tried every day to do that. And I just think the most special part about this job is that what you get back from your patients and your families is much, much more than you give. And for me, it has just been a gift for the past 15 years.
That's lovely. Thank you. Okay, let's start with Kelly. One of the toughest parts of this virus is that its contagiousness means families often can't be in the hospital with their loved ones, even if they're gravely ill. How have you guys dealt with that at Tufts Medical Center?
That is the most stressful thing that we found with this whole epidemic. It's just our families cannot be there with us. We learn a lot from our families. We give back to our families. They are so very important to the role we play in taking care of the patient. So we do struggle with that. We thought of a few ways. I'll tell you one little story. A couple weeks into opening the ICU, it became very personal for me when I was involved in coding one of my friend's relatives. In that phone call, postcode to her, I just was able to share that we were with her loved one when he passed. We were able to hold his hand and just kind of put a personal spin on it to kind of give it some sort of connection. The family members can't be here with us, so we become their family members of the patient, and we kind of stand in for them. But I just want them to know that we're there with their loved one. They're not alone. I'm sorry, it's just get very emotional about this, but so we've tried to think of ways we can involve the family. We've made family posters in the rooms, laminated posters with all their pictures and sayings and words of encouragement. And we've made YouTube videos that we play on the computers in the rooms, kind of inspiring messages from the families. We were watching one yesterday and had our patient's little niece doing some dances for the patient in the room. And it just really helps us to get to know the patient and also stand in as their family members when family members cannot be here. We also use FaceTime a lot and try to do daily calls with the family with the FaceTime so they can really feel a part of things. But that really is what we've been struggling. Our families are so important to us and the care that we give, and it's just been very trying.
Well, it certainly sounds like you guys are doing the best you can with that challenge. Andrea, how do you and your nurses manage the day-to-day stress being on the front line of this pandemic with the reality of having to get the job done? Have you seen your staff get emotional at all about the crisis, or how are they handling it?
Well, every day is different. It's a different day. When I come in the morning, I try to see what the pace is on the floor. I touch base with some of the nurses, talk to the charge nurse, see how they're doing. Some days are hard, some days are more chaotic, some days are smoother, some days are frantic. But, I have to give my staff, they're so brave. They come in every day. They go and they get their PPE ons, they go into those rooms and they take care of their patients. My role every day is just to make sure that I'm there, I'm present, giving them the support that they need all the time, huddle, giving them the information that I've heard. I feel I'm proud and I'm lucky and I'm happy that I'm working in this institution. Not to say other institutions are not doing great, but like the administration and here and BMC is like we're all here together with the staff and for the patients and to make sure that we're providing everything that we can. Keeping up the morale in the units. Because COVID affects the whole person. It affects the person holistically. So there are times when you need the spiritual, for spirituality, the emotions are setting in, and many times I remember one time I had to call the chaplain in, to come and talk to the staff just to to see, get like some calmness, some, serenity, just for the day to go by, but this chaplain did come and he did pray for, for sanity, pray for the patients, he prayed for healing, he prayed for family, and, it was very good for the staff. There was some emotions there. And normally, like when you get to release that emotions, your adrenaline comes back in again, and you're like back out to work. So it's just like morale, boosting up everyone. Making sure that the pace, try to maintain a pace where it's not that chaotic, and just to be there for the staff and to to guide them and to provide them with whatever stability I can, so they can take care of the patients.
That must be really hard.
Yeah.
Tama, tell me a little bit about whether coronavirus has affected the way you see the nursing profession, and if so, how?
I think that this virus really has the potential to dehumanize and separate us as individuals. In order to help flatten the curve, we're asked to remain socially distant from one another with masks, not to hug, not to touch. And I just think that that really goes against who we are as human beings, and it especially goes against who we are as nurses, right? Nurses really know no physical boundaries. There's really no such thing as social distancing in nursing. And when our patients are coming to the emergency room, they're coming with a fear of a diagnosis of COVID-19. And that diagnosis, as we've watched play out really globally, is extremely frightening. We together with the whole world are watching the death numbers go up every day. And so to face that diagnosis, I think, is extremely scary for our patients. And they're doing so at a time where hospitals really across the world have been forced to change their visitor policies to keep people safe, but it leaves our patients without support systems. And I think that given the right circumstance, they could feel very alone and isolated. My experience at Brigham in the emergency room has actually not been that. My experience has been that when a patient comes in, even if it takes us a minute or two longer to put on our full PPE, nurses are at the bedside with their patients, putting in IVs, putting them on the heart monitor, helping them use phones to contact their family members. I think that nursing has just not wavered through this virus. There's never hesitation when it comes to taking care of the patient. I think both Andrea and Kelly touched upon the fact that patients could potentially be dying alone. And I think that's one of the hardest parts for me to think about in all of this. But from what I've heard, nurses are not allowing that to happen. And I think nurses are referred to often as angels, and now with all of this, heroes. But I know myself, I don't consider myself to be either. Speaking with my colleagues, they feel the exact same way. At the end of the day, I think we're caregivers, right? And that is our job, and that hasn't changed. And that's what has been so beautiful to see. No virus can really change this profession. And I think it's been very evident.
Thank you. And just to tell everyone who's listening and watching right now, in a few minutes, we're going to open it up for live Q&A questions, which I'll be able to read and ask our wonderful nurses here. So what you can do to submit a question is look at the bottom of your screen. You might have to jiggle the mouse a little bit to get it to pop up, but there will be a Q&A button at the bottom that you can click on and submit a question, and then I will be asking some of them to our nurses. So let me just ask a couple more of my own. So Kelly, we know the general public has been super anxious about this pandemic. How have you and your nurses been emotionally coping and staying semi-calm, I hope?
Well, when we were asked to open up the COVID ICU, we just banded together like nurses do, and we're problem solvers, and we just went ahead and made it the best unit to take care of our patients. So we really support each other. A lot of us have been working together for many years. We know each other. Sometimes you'll have a good day, sometimes you'll have a bad day, but we really just try to talk it out, support our younger nurses. We also have a meditation room on the unit that if you just need a break, you don't even need to ask permission, just go, someone will watch your patient. But while we're busy, we're in there taking care of patients, doing what we do best, and it kind of keeps your mind off of things. I think many of us struggle when we have a day off. Everything from the week tends to just have to be processed while you're at home, having time to think and whatnot. But we just really try to stay grounded, doing stress relieving activities for ourselves, trying to practice self-care, which a lot of us are not very good at. But I think just working as a team, supporting each other, knowing you're not going to always have good days, but that you'll get through it and just take it one day at a time.
All we can do. Andrea, tell me a little bit about what it's like for you guys, to see a patient get better enough from coronavirus to actually go home, and what does the hospital do for them when they leave? And just tell me a little bit about what that experience is like for the patient and for you guys.
Well, it's exciting when a patient goes home because, like I said, I've never seen something like this in my years of being working in the medical field, and I've been here for over 35 years, and I've never experienced it all. So patients, when we see patients go home, we're happy. So we're singing, we're dancing, we're praying, we get a smile on our face, and, everyone is just happy. So, I mean, like I said, Boston Medical Center, we now started to play this song,
Don't Stop Believing.
Don't Stop Believing by Journey.
I love that.
The song goes out if you stop and dance, or you clap, or you do something just to cheer on these patients, because it's not easy that they. So we're happy when we see that happen.
And some of them have been really sick, right? I mean, these aren't just mild cases that are going home.
Yeah, these are patients that are intubated for days, and going through the illness, because COVID, like I said, it takes you holistically, takes everything it can, and just get these patients so decompensated. So when you see a patient get discharged from the ICU and is going home and not using oxygen and able to talk, you feel satisfied. You feel good about yourself as a nurse, that you job well done.
That's lovely. And Tama, obviously the hospital is trying to keep all of its workers really safe and trying to minimize the number of people in the rooms and things. So I imagine that's changed the way you guys do your jobs. Can you talk a little bit about, how have these efforts to minimize the risks to healthcare workers affected nursing, especially in the ER?
Yeah, daily coronavirus has challenged us to be able to improvise how we take care of patients. Normally, if a critical patient comes into the emergency room, it's all hands on deck, sometimes 10 plus people in the room at the same time. We've really had to improvise and change the way that we think about going into a patient's room. So we've made smaller teams, say 4 to 5, which leaves staff outside the room able to kind of still help, but not have to utilize PPE or put themselves at risk. So we're able to real-time document, get supplies, pass them in. We've also utilized technology in ways that I've never seen before. We have app and iPads that go into patients' rooms that have coronavirus. And not only can we talk to them, but we can see them, which I think is really important because it makes your patients feel more connected, number one, but also it's important to look at your patient, right? The monitor can only tell you so much. So to watch your patient breathing, to look at their facial expression, how are they doing? And I think that has been really helpful. Mostly, I think people are really flexible and willing to work really hard together as a team, just to make sure that the patient is cared for in the best way that we can do so.
That's great. Okay, so now we're going to take some audience questions. I really like this one, but it might take you guys a minute to think through whether you have something for this. Sandy asked, can you relate a particularly poignant moment or experience you had during coronavirus that stands out to you and made you think, this is why I went into nursing? Maybe you can just sort of raise your hand and I'll call on you if you have something for that. Okay, Kelly.
I think what we've seen is a team of healthcare professionals just come and do whatever it takes to give the best care to our patients. We have cath lab nurses coming to help us, endoscopy nurses coming to help us. People really have just come together as a community and just to show they care and they want the best for their patients. So it's just been remarkable to me. People that we may not have ever met before in the hospital, everyone just all hands on deck coming together just to get us all through this and our patients, you know, to get them well and recover.
Thanks. And Tama, did you have an experience that you wanted to share?
Similar, but mostly generalized. It's just been really powerful to see our profession come together, really with, not that we aren't caring for ourselves or worried about ourselves, because there is anxiety throughout the whole staff, right, about you contracting it yourself. But when a patient comes in and needs care, you put that aside, you put that down, and it has not changed. We put on our PPE, we might have some extra equipment, we might look very different, but behind the equipment, the nurses are still the same, still doing their job. And it has just been really powerful to see that, as scary as this can be, putting yourself second and really just jumping in to take care of your patient.
Andrea, do you have any thoughts on a part of this that has made you think this is why I went into nursing?
Yeah, I agree with Kelly and Tama, because just given the fact that that the virus is so, strong, it's so different on every individual, how it affects everyone individually. And it's like, it doesn't really matter it doesn't matter what the patient is or who you just go with, the nurses are going in courageously, they're resilient, they're taking care of the patients, the medical teams are there, everybody is just there waiting, ready to do it. So, it has to be like, it's the nurse that really, it's the nurse in you that makes it happen, So I'm with, what they're saying.
And this one was specifically for Tama, but maybe the others as well. He's asking, Eric is asking, have you seen examples of patients with non-COVID issues like a heart disease or abdominal pain who have been hesitant to go to the hospital because of COVID, and they end up getting, more serious because they waited too long to come in?
We keep saying, where are our patients, right? But I think that the fear of this virus is keeping people home, which maybe sometimes to detriment. I personally was not at work when this happened, but did hear about a patient who came in after 4 days of bleeding, but waited because of the fear of COVID, and ended up being quite critically ill. And it took a lot of care to take care of that patient. So yes, I think that is another challenge that isn't even having to do with the virus itself, meaning the virus taking over or you getting the virus, but it's a different aspect of this entire pandemic that we're having to deal with. So yes, it's happening.
Wow. Okay, Rhonda says, first of all, thank you, in all caps. What would you say to people who do not feel the need to practice face masks and social distancing?
We'll still take care of you if you get coronavirus. That is important, right? That's important. No matter what, we are here. No matter who you are, no matter what the circumstance. But I think that everyone can do their part, and our part just happens to be within the hospital walls, right? But I think it's important for everyone to still try to help out a little outside of the hospital. And it is showing, the evidence is showing that it's helping. So I would hope that more people would take it seriously.
And Andrea, did you have something you wanted to tell people who don't believe?
Yeah, it's the thing, it's real. You need to wear your mask, social distancing. I mean, it shows that's what helped, that worked in China, with there's literature that it works. So we should just continue to do it. I encourage everyone to, try to maintain social distancing, wear your mask as much as you can, wash your hands, you know, use your hand sanitizer, anything you can do to protect the spread of this disease.
Kelsey asked, how is it determined that a patient is recovered enough to go home? Are they retested? Kelly, do you want to take this one?
Oh, well, it's hard because we work in the ICU. So,
Oh, right. Okay.
sending people to the floor. I think it's forever changing, but it has a certain time frame where you're symptom free. And initially, we were requiring testing. I'm not sure what the stance is on that right now.
Do either Andrea or Tama know how you guys determined to send someone home?
We're not we're not really requiring retesting. We do like monitor symptoms and stuff. Like some of the CDC guidelines follow some of those, but no.
I was going to say, I think the CDC has on its website some guidelines about when hospital workers can return to work. And so I think a lot of hospitals are using that. I think it might be something along the lines of like symptom free or symptoms improving over the course of like 10 days as one of the things. Because the tests, I guess they can have some false negatives or false positives, and depending on where you are. So they might not be as helpful as we would like them to be. Okay, I don't know which one of you would want to answer this, but I'll just ask it, and maybe you can just raise your hand. Do you think this pandemic will see some nurses leave hospital work? Okay, Andrea?
Not, I don't think so, because like nurses are resilient. I mean, I know there's gonna be some, you know, I don't think many of us will leave work. I mean, I think there's some that might, but many of us will stay on because this is what we were trained to do. This is what we do. We go through this, like, we go through the pace of it, and then we'll snap right back, you know, because this is what we do.
A lot of people have asked this question. How do you think this will affect you mentally or emotionally in the months and years to come? Like, how do you think you will deal with it, you know, in the future? Tama, do you want to start us?
For myself, when I'm not at work, I try to get outside as much as possible. I'm in the woods with my wife and my dogs, and I just try to mentally remove myself and try to take care of myself to the best I can. But I think that the knowledge that there will be another COVID, not maybe COVID, but nursing and medicine has dealt with these kind of, you know, viruses or infections. We had the HIV pandemic that we had to get through, and now we have this, and I don't know what the next one will be. I hope it's not in my lifetime, but I think just knowing that we are in this together, working together always, keeping morale up, I think that's the most important thing, because tomorrow could bring something else. And I think nurses are really ready to jump in, like Andrea was saying, at the drop of a hat. And I just think on your worst day, someone is there to make you laugh, even when you think, oh, that's strange that you're laughing, but that's what you need. So I think just keeping together, banding together, knowing that something could be down the road coming for us. We don't know what it is, but I think just sticking together, working together, and keeping morale high is the most important thing.
And sort of a related question, Christine asked just now, for all panelists, how can those of us who have loved ones on the front lines, like nurses and other medical professionals, best support them during this difficult time? And I know some people are also wondering, you know, people who don't know any medical professionals just out in the public, is there anything they can do to support you guys? So Andrea, what would you say about people who have loved ones and also people who maybe don't have loved ones who want to support you guys?
Just touch in sometimes, say, how you doing? How was your day at work? You know, sometimes just to hear your voice, you know, from a loved one, you know, just checking in is enough. you know, because sometimes you leave work and you go home and you want to forget what you know, you can't forget because it's still there in the back of your head. But if you go home and, you know, it's a nice vibe and everyone is happy, it's, you know, put you in a different mood. And just touch base with your loved ones, especially the ones that are in the on the front line. We need that, you know, comfort, you know, we need some attention, you know. We appreciate that. Yes. Because we give it all at work. We give it all to, if it's not to the patients, we're doing it to the staff, we're doing it to our peers, you know. So when we get home, it's like, you know, we need some love.
And what about, you know, the public, obviously, I think, have you guys been getting some support at work? Can you talk about what you've been getting and how that feels? I guess, Kelly.
So we've been getting lots of cards and letters, gift cards to buy coffee, meals, just really feeling a lot of love and support from our families and from, you know, past patients or patients' families. So we've been really feeling pretty supported. But I do agree, it's nice to have people check in when we go home. It's really a lot to take in while we're here. So it's nice to feel supported. The public has been great, past families and patients.
And Tama, have you guys also been getting like meals catered to you guys or delivered to you guys and stuff like that?
Daily on an overwhelming level. It's the outpouring has been incredible. Thank you all who's listening, or if you know people that have helped out. Cards, messages, people even coordinated drive-bys in their car with big signs and they were beeping. It's just uplifting all the time, and it's never not noticed, and it helps. So thank you very much.
Great. So what would you tell someone who's either interested in going into nursing, or maybe they are in school for nursing right now, or they've just graduated, like someone who's young and hasn't really gotten into it yet, and maybe they're a little bit intimidated by all this? What kind of advice would you have for someone who's in that position? Let's start with Andrea.
It's a field that you have to love, and you know, you have to really want to do it, not because, you know, mommy wants you to do it. It's something has to be in you. You know, you have to want to do it for you to be able to, you know, do it. So I will encourage you, if you really want to do nursing, yes, do nursing. It's a good field. It's a good experience. You learn a lot. You know, it's exciting. It's, you know, some days we have like what we're going through right now, but there's some fun days, there's some good days, you know. So, you know, if you really like to do it, just do it. Do it for you. Yeah.
And Tama, would you have any advice for someone who's interested in nursing? We even got a question from someone who's in high school who's interested in becoming a nurse. So what would you say to them?
I think if you're already thinking about it in high school, the passion is there. Absolutely go for it. And we're all waiting for you when you graduate to help you and guide you in any way that we can. It's a great job. I love this job. We're very, very lucky. Pandemic or not.
Kelly, do you have any words of advice for someone who's interested in pursuing that field?
I would say maybe seek out a summer internship or come shadow with us. Hopefully you'll feel our passion when you follow us around. And if you don't like one area, there's so much you can do with nursing. So I would go for it.
Okay, as Kelly noted, so this is from someone named Mary. She says, as Kelly noted, patients are not with family. Families are desperate for information. How and who communicates a patient's condition to the primary family member, and how frequently do they do that? I know it probably varies a little bit, but Kelly, do you want to take a stab at responding to that?
I know our physicians are great about communicating at least once or twice a day with family members. Nurses, we're always available. We try to call each shift. We try to get a FaceTime visit in with multiple family members at least once a day. We really try to make it a priority so people feel connected and that they're here with us. We have one of our unit coordinators comes in on her off days to actually do the FaceTime with families. So we're utilizing other people other than nurses to do the FaceTime, and that really helps.
And I know you're in the ICU where a lot of the patients aren't awake, right? They're on ventilator, they're unconscious. Can you talk about what that FaceTime is like for the family and for the person who's holding the FaceTime? Like, what does that entail when you're talking to someone who's, in an induced coma?
Right. So we always assume patients can hear us no matter how sedated that they are. So the family member just loves being able to look into the room, look at their loved one's face. We had a gentleman give a thumbs up to his family, although he was heavily sedated. Just little gestures like that just make them, they just want to take the peeks on their family member and just make sure they're doing okay. So our unit coordinator will make the connection first with the family, and then we'll FaceTime kind of with the patient in the rooms. We've also used baby monitors so the patient can hear over the baby monitor as the family member's talking on the phone to the patient as well. So we always assume patients can hear, and we capitalize on that with the FaceTime visits.
And Tama, you're in the ER, so the patients are awake usually, right? Have you seen any interactions that stand out to you when they're talking to their family members and maybe they're about to potentially be intubated and not be able to talk for a while? Like, what is that like?
Yeah, that's one thing that we're all really trying to make an effort to remember. When patients come in, if they're very critical and need intervention immediately, sometimes that can get lost, right? You're just focused on getting the breathing tube in, getting the IV in. But we've really made an effort to reach out to people's families before that happens, because knowing what we know about COVID-19, it's very real that not everyone is going to come off the breathing tube. And so we've utilized a lot of support systems. A lot of our patients actually, we've run into don't speak English. So our interpreter services have been a lifeline to us. They will come into the room, make the connection with the phone call, FaceTime, anything that we can do to get the family to be able to talk to their loved one beforehand. If we can't, sometimes people are willing to do a video of the patient that we save to send to the family after the fact. So we're, thinking outside the box and changing as we go, and every day is different, but trying really hard to make that connection for the families.
This question comes from a viewer who says, we've seen so many medical workers on cable channels talking about problems with PPE and equipment, personal protective equipment. Have you guys experienced any shortages or any problems with trying to keep yourself safe or having the right stuff that you need to do your job? I guess we can just start with Tama and then go around.
Sure. That PPE has been a discussion from day one. And I think the most important thing to remember is that it's not a Brigham and Women's Hospital issue. It's not a Tufts Hospital issue. It's not a BMC issue or even a Massachusetts issue. It's a global issue. And why we don't have it enough, or why we're being so careful with our PPE, I won't speak to that. I don't know the answer to that. My hope is in the future, if this happens, then we are more prepared. But I think that we have what we need to take care of our patients, but it just looks very different than it did 2 months ago. We do have to reuse N95s, usually for an entire shift. That's new to us, and it's anxiety provoking, but we have resources that they've put in place, actually people to help us that have come from different areas that have been displaced that maybe aren't seeing patients right now, cath lab, et cetera, who are actually willing to stand there and walk us through the process of donning and doffing safely, meaning putting on and off our PPE. Brigham and I think MIT and Harvard made face shields out of 3D printers. So, you know, technology is there, we're utilizing it. But yes, it's a constant conversation. It's a constant conversation.
And I imagine that you're trying to sort of conserve it as much as possible because it isn't sort of an unlimited resource. Andrea, has that affected your job at all?
Like Thomas says, you know, we're just, you know, we have our PPEs and we're just trying to be conservative. We just started doing reusing PPEs, reusing the face, the N95s, but you know, it's all over. We have supplies that we need right now to take care of our patients. We have enough, and we're doing okay. But there are the hopes that, you know, we don't run out, or the hopes that, you know, what if we run out, you know, stuff like that. But it's a conversation with every hospital.
And Kelly, I know you mentioned something about Ebola to me earlier when we were waiting for this to start. Can you talk about how that affected your PPE?
Sure. Our unit has been using a lot of the PAPRs that they had left over from Ebola. So in that way, we're conserving PPE because we all have our own hoods to use. There's been some issues with that as well. But just it's hard to hear with the PAPR and the hoods on and whatnot. So we are being conservative with our PPE. But we feel pretty safe that we have enough to care for patients at this moment. We also have staff watching us donning and doffing, so that really helps ease some anxiety while we're trying to care for the patients.
And Tama, can you walk us through what doffing requires? Because I heard about this recently, and it sounds like a really intense process.
So it's the process of safely removing personal protective equipment. Donning is putting it on and doffing is taking it off.
And what does doffing require though? Because what I heard is you sort of have to like individually walk us through what you have to do.
Yep. So we're wearing, if we're doing procedures such as swabbing a patient, anything that is increasing the amount of droplets in the room, we're wearing double gloves, N95, face shield, and often a hair net and a gown. And so we have really been lucky to have somebody helping us every single time that we remove our equipment. And so the first pair of gloves comes off, you Purell. The face shield comes off, and you actually are able to hand, before you take the face shield off, the gloves, the gown is coming off with the under pair of gloves and making sure you pull it away from your body so that it doesn't touch your shirt or your arms. And then you're Purelling. And then your face shield is coming off, and we're actually able to hand the face shield over to somebody who wipes it down for us with disinfectant wipes. And then Purell, and then the N95 comes off in the safest manner possible because the outside is technically contaminated.
Wow. How long does all that take?
Yeah, so that's the thing. Things just take longer now, a lot longer to put it on, to take it off, etc.
Wow.
A few minutes, I would say. Well, wouldn't you guys say a few minutes? Yeah.
And have any of you had any colleagues get sick, and what kind of impact has that had? Let's start with Kelly.
We have had some employees in the hospital test positive. Really, we've tried to reinforce HIPAA policies. People are curious, they want to know all the details, and we've really just tried to protect people's privacy while they're out recovering. It's just really important, but it is common. People want to know the story. I think it's their fear and anxiety that they're going to get infected as well. And if you were exposed, you will go to employee health and get tested. So it's been an easy process for that, but still anxiety provoking.
And Andrea, have you had any of your coworkers get sick, and what was that like?
Yeah, I've had a couple of my staff that became positive, but some of them are back to work. I try to keep in touch with them by phone. I call them, check in on them, see how they're doing. Sometimes I email them. Yeah, they're like half of them are back to work now, so and doing well. The others are doing well. None has been really hospitalized. I have maybe like a coworker that was sick and hospitalized, and she's home now. Yeah.
Okay, so this question is asking, were you disappointed about the change of policy regarding wearing bandanas and working with exposure, awaiting symptoms versus quarantine, the acceptance of surgical masks versus N95, the reuse, and now decontaminating of masks? I guess this question is sort of about, over the course of this pandemic, these standards have gotten a little bit more relaxed, I think in part because of the lack of PPE or personal protective equipment for people. So has that affected you at all, Tama?
As far as like morale goes,
Yeah,
I think
so.
I think the biggest thing that I always try to remember with this is that it's ever evolving and ever changing, and we need to be flexible. And we are. From what I've seen, we are flexible. I came in one day, and at 8 o'clock in the morning, the way that we were doing things was set. Everyone knew it was across the board. At 2:15, we got handed paper saying this is the new way that we're doing X, Y, and Z. CDC changed, what have you. So I think if you let every little change affect you, I don't know that you would make it to the end of this pandemic, because change is so constant with COVID-19. So I think you just be flexible and try to do what's safest for you and your patient at all times.
And Andrea, someone asked, how do you manage to think critically when you're under a lot of stress? So I'm just curious if you have any thoughts on that.
It comes with practice. It's by doing it every day. It's easy. Because you're as a nurse, you can do as many things. We're always multitasking, and critical. You can look at critical, and you will know how to act. It's that adrenaline. So it's just you being a nurse.
And Kelly, do you have any thoughts on that? How you manage to think critically about everything when it's chaotic?
I think it just comes naturally. You're a nurse, you're at the bedside, you're just doing what you've been doing for all these years. We also utilize our support nurses a lot. So if we're trying to multitask and just not getting ahead of things, we'll pull them in and they'll use their expertise and help us document, get meds that we need, just anything they can to help us, record during an emergency, do the documentation. They've just really been great, but you have to just learn to ask for help and utilize those support people. But I find if you're at the bedside and you're busy, it's just coming naturally. You're just doing your job. Just get into motion and just do what you've been doing all these years.
And Tama, what about you? Do you have any insights as to strategies that you have for staying calm under pressure?
I agree with both what Kelly and Andrea said. I think that part of it actually is the easier aspect sometimes of our job, right? Because you just get into the mode, you're in the zone, and you do your job. I think there are other things that are more challenging. I love critical care. That's my background. So for me, I think, I don't know, it's like a switch, and it happens and boom, you go, you do it. Yeah.
Andrea, have you had to deal at all with worrying about infecting family members or friends that you hang out with outside of the hospital?
I practiced, what, we're told, like, you go home, I wear scrubs to work. When I go home, I take off my clothes at the door. There's a lot of other ways that you do it. Some people take them off in the car. I will go to the doorway inside and I'll start to, take my stuff off there, just to protect my family. And I try to stay in my room, stay away. Like when I first come home from work, and then I get showered and everything, I start to mingle with my family, so we do try to protect ourselves, when we leave work.
And what about Tama? Or I guess your wife is also a nurse, so maybe you don't have the same concerns, or do you?
My post-work experience has changed greatly in the past 2 months. It's quite the long process now. Mostly in the emergency room, we're seeing a lot of patients with COVID-19 or risk for COVID. So we have access to our scrub machine at Brigham, and so often we will change before we leave. But even that doesn't feel enough, and you go home and you shower for what feels like forever in the hottest shower ever. And then I feel a lot better. And, wipes in your car, disinfectant wipes, like anything I touch, I feel like I'm constantly wiping. It's really a different way of living that I've ever done. I know that.
Okay, somebody asked, Pam just asked, how do you refresh yourself physically, emotionally, spiritually, so you can continue to provide the amazing care you do? Kelly, do you have any thoughts on that?
I try to disconnect from social media, the news media, really just try to separate from anything COVID related. Oh, geez. While I'm not here at work, I try to talk with family and friends, maintain connections with people, a lot of Zoom calls. But I really just try to disconnect from the hospital when I'm not here.
And Andrea, do you have any coping techniques you want to share in terms of staying sane?
I like to listen to music. So I listen when I'm driving home. I play reggae music, and I just like block everything out. Just drive home, and I go home. I meet with my kids, and we talk about everything. My kids tend to not bring up work issues. When I come in, they turn the TV off because they know I don't want to see anything about COVID. Yeah, I can't see COVID when I come in. It's like enough already. Yeah.
What about you, Tama?
I agree. I think we're getting a lot of information all the time at the hospital, and that seems to be enough for me. I'm not watching the news as much as I usually do. I'm trying to be outside. Little mental health things that we can do for ourselves. Yeah.
All right. Well, we have just 2 minutes left, so I'm going to turn it back over to Jennifer and just take a moment to say thank you again to our lovely nurses. This has been such a lovely conversation, and you guys are so amazing. And Jennifer is going to close us out. So thank you.
Thank you.
Thank you.
Thank you, guys. Naomi, thank you for a great conversation. Kelly, Tim, and Andrea, I can't say thank you enough for your words of advice on how to inspire us all to cope and to get through this, through music, through celebrating the healthy moments, and through just really staying grounded and keeping each other up, keeping morale up and supporting each other are great words of advice. We are grateful to all of you. So thank you for sharing your stories today.
And just wanted to tell everyone, thanks again for tuning in. Thanks to our wonderful nurses, and just keep your eyes on the globe as much as possible. We are doing our best to inform you about everything and provide some distractions as well that aren't related to COVID. I know we have an interesting fiction novella that we're publishing that's set in Boston, because we understand, we don't all want to just be reading about coronavirus all the time. It's so mentally draining. But anyways, thank you all so much for tuning in. Thank you to our amazing nurses, and let's keep appreciating healthcare workers even after this. All right, take care.
Thank you.
Bye.